Podcast is now starting. All attendees are in listen-only mode.
Good afternoon. Today is Friday, January 8th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and on questions today is Patricia Sastoque, Director of Programs, Valerie Roddy, Director of Fiscal and Operations, and Rhonda Workman, Director of Federal Programs. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is a handout for the webinar, and you can find it in the handout section in the panel to your right. They can also be emailed upon request. We will be recording the webinar and posting it on the DDA website. Questions can be typed in the question box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and thank you, Donna. And if we can go to the slide that says the agenda, I'd appreciate that. So let me first start by saying it's been a little bit of time since we've done one of these webinars. So, and with today being at the 8th, I just want to wish everybody a Happy New Year and thank you for all the amazing work that you've done to support everybody with your staff, people you got in supports, families, etc. And may 2021 bring good health to everybody as we talk a little bit later in the presentation about vaccinations, etc. And I do want to stress that I want to thank you very, very much for attending these webinars and engaging with us at DDA in making sure that you're giving us good questions and wonderful suggestions. So again, I'm going to give you an update on some critical things that happened since our last webinar. Next slide. So again, as we go into 2021, we remain committed to supporting health, safety, and well-being. We remind everybody that you should be keeping social distancing, washing your hands, etc., as we continue to create a flexible, person-centered system. And again, I want to thank people for the creativity that they've done in using a lot of remote activities and interventions with people, and then making those suggestions that they should be integrated and moved into our home and community-based services so that it's not just in an Appendix K, and then when the pandemic goes away, that we don't have the same opportunity. So I think people were very, very good and very creative in everything that they've done. So again, I want to be able to say thank you. I can't, there's not words that I can express to say how grateful I am for everything that everybody's done in our DDA system. Next slide. So on Tuesday, many of you may have seen Governor Hogan's press conference where he announced some actions for around the state around the vaccines. And as he mentioned, to date, they've successfully allocated 270,000 plus doses of vaccine, which is about 98.7%. And that was this information is taken right from his presentation that he had done. But for those of you who didn't see it, I think it's worth talking about that he mentioned a series of 6 steps to help accelerate the vaccines. So number one, he talked about the National Guard and them being dispatched as emergency support teams to the local health departments. And we know that we've had a lot of conversations with people about PPE and going to the local health departments, etc. They're there for you. They are a great resource. And as the governor said, they will have 14 Guard members in each one of these vaccination teams. He also talked about the 700 volunteers that people who have qualified, who have either been retired or not necessarily working within a clinical field, but do have a clinical background and like RNs, et cetera, that might be doing something different, but not necessarily working in a hospital or in any specific area that's healthcare, that those volunteers will be really helpful to assist with the vaccination administration. He did express a little bit of concern that with the way the data looked, that evidently the federal contract with CVS and with Walgreens says that the information should be uploaded into the system within 72 hours. The governor did an executive order so that everybody could see in more real time what the actual vaccination rate looked like. So it's within 24 hours. So that's something that he had also talked about. And then he has worked with the Maryland Hospital Association to look at PPE, vaccinators, logistical supports, or whatever. And this will all be in links that we will have that you don't see on this page, but we will have as we roll the PowerPoint out and put it on our website, or for anybody who requests. He also stressed that there are some, he was concerned that about 75% of the first doses that went out were allocated, but you know, if somebody isn't going to use the dose versus it's sitting on the shelf or sitting in a refrigerator or a freezer, that they would just start looking at how to reallocate some of that stuff so that we could get more people in the state vaccinated. And then lastly, that's what he talked about that I just said with the 75%. And so they used the example of the Southwest Airlines model for boarding. You know, if you're in Group A, you get on with A, but if you decide you're going to go, if you're at BWI to go get a cup of coffee and A boards, then you get on with B, or however that works. So it's not like, you know, you may be able to cut the line or do whatever. So let's go to the next slide, Donna. So as we look at this, this is what the governor has used in his presentations for where people are in the priority of immunization. And you'll see that healthcare workers are up in 1A. And then you will notice that in 1B, it basically says assisted living, other congregate settings, etc. What the order actually talked about was a phase 1B will include Maryland's age 75 and older, special needs group homes, high-risk inmates, and the developmental disabled population, which is us. And then issues on continuity for government, for teachers, et cetera, et cetera. So again, we will be in phase 1B for all of the people that we provide supports to. And then when we have a little more information, we'll share that, we'll get it out. I think it's one thing to talk about we are in 1B for the people we provide supports to, but I think we need to think about what do those logistics look like. You know, there's consent forms, there's a lot of details that we have been talking about that we want to get some feedback from individuals, families, and providers as we discuss next steps, because it's one thing to say we're in 1B, it's another area I really believe that we operationalize that. You know, if you get a call from Walgreens, what does the individual on the other end of the phone who answers say about, you know, consent forms and, you know, obviously there's scheduling, there's all kinds of details that we will continue to work through. But we do have some of our staff who basically right now sit on the vaccination committee. And so obviously we have people who can be able to take a look at that and raise some questions and do some follow-up with any concerns that anybody might have about the specific details. Next slide. So as you know, currently we're in phase 1, and obviously that's frontline hospital staff and healthcare, the nursing home residents and staff who were there, law enforcement, firefighters, and all licensed, registered, and certified healthcare providers. So I think that should cover people that we have in our supports that are med tech or have some type of registration and or certification with the Board of Nursing, et cetera, since I would think that they would be a certified healthcare provider. So I think we need to move forward with that and those folks. Next slide. So this is just an overall piece of information with links on it that has various information. And this is just at a glance, it's on the website. But again, I would ask people to, when this is posted, you can go in and take a look at it, and you'll see it's got a phase 1A, a B, C, phase 2, and then phase 3, and what that looks like for any additional information, etc. Next slide, please. So this is what we had taken from the DD Council that they shared with us, and it's on their website, but there are links and there's really good information here. So I want to thank the DD Council for everything that they've done around discussion around COVID-19, vaccines, the FAQs. You know, it's a really, really useful document. It's in plain language. It's actually, I think, really outstanding, and I want to congratulate the DD Council for exceptional job they did with this. Next slide. So as I mentioned earlier, here's some of the links with the vaccinations, et cetera. The first executive order on vaccine reporting within 24 hours, as I mentioned earlier, it was a 72, and the governor said no, he wanted a 24. And then you will see other areas about who can administer the vaccines, preparation for vaccine administration, the allocation priorities, et cetera, et cetera. So again, you may want to, when you get these slides for the webinar, please click on it and have yourself familiar with this information. Next slide. Okay, so we get a lot of feedback on Amendment 3. I think that it was absolutely great, always useful. We put a lot into it with your input, and obviously we got responses to the initial questions, and then we responded back, and we will continue to work with Medicaid for updates and share information and guidance on the amendments as an implementation and timelines, et cetera. So again, I think this was an outstanding collaborative effort, and I want to thank everybody for their feedback and all of the information and suggestions that we received. Next slide. So as you can see, on the 22nd of last year, CMS updated Appendix K on with dates and other information about unwinding and what does this look like in the future. And for Appendix K, states can request an end date after the 6 months after the public health. So it gives you time to unwind and figure out, you know, what is the quote unquote new normal look like as we move forward, but still gives us an opportunity to have Appendix K at our disposal for use with the relaxation of the service delivery system or a different way of delivering services than what we've been doing. You know, example, day services being done in a residential site, they approved in our Appendix K. Next slide. So we're working with Medicaid, obviously, to extend this beyond the 6 months so that we have a good, clear pathway that it's not like, you've been in a pandemic for a long period of time and you're doing business differently. And now come this upcoming Monday, Appendix K goes away and you flip a switch. It's not, life doesn't work like that. We need to be very thoughtful. I know that many of the providers have been working on a regional level and having discussion with the regional directors about what would a reopening strategy look like. We know that we've got a couple of documents that we have on our website about what does reopening look like. One from the State DDA Directors Association and the other one from the Academy on Dental and Developmental Physicians. And so obviously there is some a good information there about the possibility of reopening when we do that. And again, we're in no hurry to reopen. We want to make sure we do it right, and we'll continue to move forward with this. Okay, next slide. So you may recall that the governor on December 17th had a press conference, and he announced that he was moving the date from July 2021 for the provider rate increase until January. So 7 days ago, January 1. And so what does that mean? That means that we are working on updating the rates in the system to get the 4% in. Adjustments will be made to the cost detail sheet for invoices for people that are on operating under PCIS2, and then for the providers who are in LTSS, those rates were already updated on December 31st. And so, and again, as you see, the foundation is the brick and the wage as we continue to build the way we're moving forward. But I think we all need to collectively thank the governor for moving that back 6 months to January 1 instead of the time frame of July 1. Next slide. So I'm committed to the success of self-direction. We're over 1,200 people now. We've done an excellent job, I think, in trying to engage with everybody, listen to everybody, make sure that everybody has the opportunity to self-direct their own services. And then again, as we continue to move forward, we want to have some webinars, and you can see the dates that are on this slide for participants and families. And these are informational webinars, and I would ask that hopefully we can get people who are either interested or people who are already within self-directing their own services, that we're going to be hosting these. And it's going to be regarding basically the person-centered plan process, rate increases, etc. So again, I encourage everybody to, as we get these dates out, and you see there in January, that if it's convenient to people to register, and we can again work with the CCSs and providers, etc. If people want to leave traditional services and go into more of directing their own services. Next slide. So this is the updates that we do on the numbers with COVID. So as of yesterday, the South region had 451 confirmed positives. This is for people in supports. Had 21 deaths. We have had 87 confirmed positives in the East region, and 4 deaths. Central region has had 644 confirmed positives, and 13 people have passed away. And in the West region, it's 221 confirmed positive, and 6 people have passed away. For staff, it's 312 in the South region, with 5 people who have passed away. In the West region, it's 179 with 2 people who have died. In the East region, it's 152 positive results from the test, and 1 person has passed away. And in the Central region, it's 548, and 2 people have passed away. Next slide, please. So the pie chart on the left is what we've been doing right along, and it's about the 17,764 that we provide supports to, and we've got about 8% of those people that have tested positive. And this is a 2% increase since our last webinar. And so you can see the chart on the right shows the regions, and it shows from, you'll see December 3rd. And if you look and drill down on the right, you'll see the actual increases. So that Central is up by 110, et cetera, et cetera. So, you know, you can see where we are with the number of people that are testing and where they are, testing positive, et cetera. Next slide. All right, so from December 3rd until January 7th, yesterday, we had 8 more individuals in our supports pass away. And then the chart on the right shows that the people who have passed away is 5% of the total amount of people who have tested positive for COVID. Next slide. So during the last few webinars, people wanted to know about, so you talk about people who are in supports and services, and we have something on self-direction. So this is the self-directed services that we know that we've been engaging with folks, and you can see that the number of people who have tested positive, and you can see that there have been, which is 19, and you can see that there's been 0 deaths for the people who are in self-direction. All right, next slide. All right, so this is our schedule for our webinars. So with that, I am going to stop here. And again, if you could mark your calendars ahead of time so that we're not, and obviously you can sign up with through Donna Will, as you did as of even this morning. People were still signing up, so that's good. So with that, I will stop here, and we can go to questions.
Great, thank you, Bernie. Appreciate that. There's lots of questions about the rollout on the phases in reference to CMTs, CNAs, DSPs, Directors for Professionals, families, and people in self-direction. So I'm going to ask some questions of Bernie, and then I'm going to ask some questions of Valerie based on what's in the chat. Please note that the link that is in the website that we share on the PowerPoint is directly from the governor's office. Please know that every phase has a specific steps with specific populations and direction. And so we all fall in the multiple phases. 1A, we also fall under 1B, and we also fall under 1C, depending on the staff or where people are. So with that being said, I'm going to ask a question of, I'm going to start with Valerie. And this one has to do with the site address that the pharmacists have in their system are largely inaccurate. How can providers get this list corrected? And generally, how can people actually access the vaccine? Will DDA provide letters that they can take to the pharmacies or health departments to confirm the individuals and DSPs are eligible?
Okay, so let me start with the addresses. So we have been asked, when I say we, DDA has been asked to provide information at different points as this vaccination plan has evolved. And it is a living document, it has evolved. So the first data query that was requested was around people in our congregate settings, which for us is our residential sites. And the focus was on those people who were 60 years and older, because again, the trajectory of the coronavirus, impacts folks who are older. So that was the focus. So we pulled that information. And what I'd have to say is the data comes from the systems that we possess, both PCIS2 and certainly LTSS. So if there is that is where the information is coming. If something is incorrect, an address, it's really important for providers to let the regional offices know, because the regional offices are responsible for updating our databases. So that's the first part. Secondly, in terms of, so that's how you correct it through us. So if you can get it corrected through us, that'll be a help. And then in terms of correcting what the pharmacies now have, I have sent some questions to our public health partners to get clarifications, because public health is really the lead in our department in this effort, and they are working with the federal government. There's a federal program which they have a partnership with, in particular, CVS and Walgreens nationwide for the administration of the vaccines. And so they are working with them. So we don't have a direct link, but I have asked about how we can make these corrections. But it really does start with providers. If you know that there is an address that's not correct, or maybe there's a site that you're no longer using, please, it is at these times when it is most critical for us to have accurate information. And we do depend on providers to alert us to whenever there are changes.
Valerie, who will you, when you say alert us, who would you like the providers to contact directly?
They should be contacting the regional offices.
Thank you. So this one is, Bernie, I don't know if you wanted to explain a little more about this. This is more of a comment and then into a question. Walgreens and CVS has the entire protocol worked out, including scheduling, consent forms, setting up the clinic at the homes, etc. Why would we need anything different from what we do for the vaccinations?
Well, I don't think we do. I just want to make sure that everybody knows what the system is, and if there's anything that in any recommendations that anybody has. I know that Walgreens has called some of our providers and is tentatively is scheduled to go in. I know when we were discussing with Walgreens at our state residential facilities that they have their own forms for consent. So it wasn't a DDA consent form, et cetera. So I just wanted to raise that today to make sure that, it was more informational than, which is what I was trying to get to, on informational and where we are with the rollout.
Thank you, Bernie. This is a two-part question too, one with a comment and another with a question. Can DDA please provide something in writing that the direct support professionals who are MedTech certified are in 1A or other DSPs are in 1B? This week, someone from the department shared that other DSPs are in 1C, so it's very confusing. We wanted to mention that. Go ahead.
So let's think about this. You're in 1A if you are a med tech and you are registered with the Board of Nursing. Go back and read the governor's order that basically says this is who is eligible, and you can go back to that slide, Donna, if you would. The second thing is the people who are non-med tech, etc., are in 1C, not 1B. So it's 1A is for the people who are would be med tech in interacting with people because they fall under the executive order. And then 1B are all our people in supports, and in 1C is the other non-med tech staff. And I know there was a little confusion about that because I did see and had conversations with people outside of DDA and outside even the Department of Health that basically said, well, are the rest of the people in B or in C? And you're in C. And if you go back to the governor's triangle, Donna.
Last 6, Donna. Yep.
No, next one.
Oh,
Go back to one before. All right, it says right here, essential workers is 1C. And that's what we were. And if you recall, early on, there was nothing about our DSPs being essential workers. There was some conversation about that, and you saw in a subsequent governor's order and in a secretary's order that our DSPs were considered essential workers. So that's what 1C is. It says essential workers, and obviously it's lab, agriculture, manufacturing, post office, etc., and we would fall under there as an essential worker.
So Bernie, people in self-direction and families want to know, where do they fall?
Well, it depends if you're a med tech. I mean, if somebody's in self-direction and you are have a label of intellectual and developmental disabilities, you're 1B. That's all of our people. There's no distinction between if you're in traditional services or if you're in self-directed. And so an intellectual and developmental disabilities is the way the governor's order was written. And so so I'm not really totally understanding the question. If somebody is self-directing and is hiring a med tech, then that staff should be eligible because they have to have that certification and pass whatever test needs to be done and registered with the Board of Nursing. So they would be in 1A. And then the other staff who may not be given meds and wouldn't meet the 1A criteria would fall into 1C.
Thank you, Bernie. So there's some questions for Valerie, and I'm just going to go through some questions for you, Valerie. Is how will DDA fund individuals in only meaningful day services have access to the vaccine? Residential agencies are currently being contacted by Walgreens, CVS, but many agencies not providing residential have heard nothing about the vaccine. And I think this is what, Bernie, you were talking about. So hopefully Bernie's response answered that question. I don't know if there's anything else, Valerie, you want to add to that?
You know, we're still working with our public health partners to understand, you know, how all of this is going to roll out. You know, they are the leads in terms of the planning component of this effort. And to be honest, we're still getting some details. So, you know, when we have the additional information, we'll be happy to share it. I do want to just reiterate that again, when I answered the question previously, you know, the first request for data we received was essentially a subset of the population that DDA serves and supports, you know, and that was focused on those folks who were in our residential services and who were of a certain age. You know, since then, there has been additional data requests, and we've been providing that information. So, you know, it seems to be happening on a rolling basis for the information. So we do not have specifics at this time, but as information becomes available, I'm sure the Deputy Secretary will share that information.
Thank you, Valerie. Yeah, because most of the questions that I'm reading is, how do folks actually who are in that group right now, 1A or 1B, get the vaccine? Like, is there going to be a sign-up sections where Walgreens contact them? Do they have to do a call-in and set up an appointment prior? Is there a link? They're asking all those questions at the present time. Okay, then there is some program questions here, Valerie, for you. And since we are now into January, and many of us have not been able to close June 2020 year and audits due to God needed on retainer days, what does DDA suggest we do to complete cost reports that are due by January 31st? Has that grace period been extended at all?
Well, I guess there's some good news in that we do have some more clarification now because our Appendix K has been approved. But, as you said, this is, January the 8th, and we were requesting that the cost reports be submitted by the end of this month. This has been a very unusual year. I will go back and see if we can take a look at extending the date, because we do recognize that agencies still need to take care of. We held the error updates until we got a final word from CMS relative to the retainer days. And so since we literally just got that approval, we'll be going back early next week to work out these details. But one of the considerations will be whether or not we will grant another yet, not so much an extension, but more like a grace period for the cost reports.
Thank you, Valerie. Rhonda, I have a couple of questions for you. Donna, can you go to slide 13, please? All right, and can you talk a little bit about our Appendix K? And then can you give an update on the specific guardrails that were referenced there? And so, so people want to know a little more about this.
Sure, absolutely. Patricia, can you hear me?
Yep.
Okay, great. So for our Appendix K, the Deputy Secretary shared that, we are in the process of extending it beyond the current expiration date. That date would be 6 months after the public health emergency. But we also received approval this week from CMS related to our request to provide up to 60 retainer days for our community living group homes. You may recall we had shared previously that we were seeking to provide multiple episodes, which then, as per CMS requirements, would trigger what they call guardrails. And the guardrails, the way that I understand it, is attestations from providers to meet the standards that CMS had put out so that they can have some assurance that the funding that they're providing for retainer payments don't duplicate other funding sources. And I know that's kind of general. We will be providing additional guidance and updates because of this approval for our retainer payments. We'll update our Appendix K memo specifically related to the retainer payments, in addition to having that additional update, as Valerie said, related to the PCIS2 error updates. So again, the approval is to support our community living group home providers to have up to 60 days. In a sense, it's that kind of residential retainer fee of 30 days we had, plus the additional 30 days we got approved for the COVID-related retainer payments. Meaningful day services will remain at the 30 days request that we had, and personal supports will remain at the 120 hours. But we're really happy to have that approval to provide up to the 60 days for our residential services, and we'll be working on guidance and updates to share as soon as possible.
Thank you, Rhonda. There's one more question for you. If a TY chooses to stay on the autism waiver rather than go immediately into adult services, can they stay on the autism waiver until 6 months after the public health emergency?
Yes, that's a great question. And the answer is yes. The department has submitted, in addition to the DDA's Appendix K, they also submitted a request for an extension to 6 months after the public health emergency for the autism waiver Appendix K, which provides that flexibility for a youth to remain in the program at this time.
Thank you, Rhonda. Valerie, you had mentioned earlier for the folks to contact the regional offices to making sure that they were on the list for the vaccines. So who from the regional office should they be contacting? If you're speaking, you're on mute. I will respond. So we want to make sure that you contact the regional directors. If you need a list of the regional directors, we will, in their email, we will share that with you through the people that register here so that they know. So we will do that. Let's see if there's any other program questions. I'm just going through this real quick. Mainly all of them is about making sure that the list on the how to make sure the Walgreens and CVS have their agency name. What about families? Would families who serve who have people in self-direction in the community be able to get the vaccine with their within their face of their loved ones? Bernie?
I don't know. I mean, I think people need to understand that, you know, we didn't know where our population was falling into until, you know, the last press conference that the governor did on COVID, et cetera. I mean, he's done other press conferences since then. But, you know, so this is as, you know, we need to understand that this is a rolling work in progress. I don't think we have all of the answers, which is why I said earlier we have people who sit on the vaccination committee that represent us, so we can take those questions back and see if we can get some clarification.
Thank you, Bernie. Donna has posted the emails for all the regions right here, so if you need to, they're in your slide and they're posted right there. I just wanted to read this out. Just wanted to thank you all for the work on pushing the amendment. And to Kay, it's big, a darn deal, and I'm grateful, so thank you. Thank you. Back to you. Thank you so much. Rhonda, for the retainer days, do they still need to be consecutive days?
Great question. The answer is no. Working through our Appendix K revision, we requested that the term consecutive billing days be removed, and that was approved.
Okay, now that there's guidance on retainer days, is there a time frame to submit error updates since the FY20 cost sheet is still due 1/31/21? Valerie?
Yes, no, I think this question was asked about 2 or 3 back ago. The response is this, you know, as Rhonda's noted, as I have noted as well, you know, early next week, we're going to be working on updating all of our guidance relative to the error updates and the retainer days, since we now have this approval from CMS, which we didn't have before. So now we have that, so we can move forward. And as part of that, we will also take a look at extending the grace period for cost reports. And if that occurs, we will push obviously something out to all the providers so they are aware.
Okay, thank you. This is for Rhonda. Will there be an additional to the 2,000 that DDA is allotted for self-direction for Appendix K, or will participants have to request more than 2,000 funding?
That's another good question, and the answer is no. What we're talking about, or what the question I believe is about, is through the Appendix K authority, we did offer an additional $2,000 for people's self-directing services to kind of help with things like PPE and things like that when COVID initially hit, based on funding that we had allocated at that time. The extension of the Appendix K does not refresh or provide those additional funds. It just allows us to have more time to implement the flexibilities like family members as staff and such. So there is no additional $2,000.
Thank you, Rhonda. Bernie, this one's for you. Do micro boards fit under 1A?
Well, 1A is basically you'd have to have the certification for med administration, et cetera. I mean, I don't know if a funding stream is the way to approach it as opposed to, what are the categories? So if you have somebody in a micro board who is the med tech, et cetera, and is certified by the Board of Nursing, et cetera, then yeah, they would fit in 1A. The individual who is receiving supports through the micro board would be 1B, and all others would fall in 1C.
Thank you, Bernie. This is a Valerie question. Are there any additional requirements for retainer days? I know it was previously mentioned that there may be more requirements to prove days, to provide days.
No, I don't. Yeah, I don't. There aren't any other additional requirements. I guess I'm not sure I understand the question. There aren't any other additional requirements for retainer days, other than what has been in place since the start of Appendix K.
Right, and what we're going to do at DDA is we're going to update the memos and the guidance that we gave out, since we now have a new revised approved Appendix K. And you saw on the slide that the next step is to update that. So what we're going to be doing in the next 5 working days is to try to get that updated and then put it out through constant contacts and update the website so people would have the most current information. Will respite funding be extended under the continued Appendix K supports, Rhonda?
I'm sorry, can you say that one more time, Patricia?
Will respite funding be extended under the Appendix K supports?
The current funding that we allocated with Appendix K when it initially occurred is the only funding that's allocated. So we're not allocating additional funding for any additional services.
Okay, great. So this one is Valerie. Is there any increased rate for providers to continue to provide meaningful day services to those with a positive COVID or in isolation, et cetera, similar to the community living, group home, and supported living?
No, the isolation rate applied to community living, applied to personal supports. What we had under meaningful day were the retainer days, when services could not be provided, but there was no other accommodations for isolation days, because isolation days are tied to, a residential situation, whether it's your own home or if you're in a provider operated home.
Thank you, Valerie. Some folks are asking will the guidance be issued next week to include specifics on how to apply the guardrails for claiming retainer days, Rhonda?
Yes, we will be coordinating with Valerie in terms of any attestation we need for the guardrails, and we'll note that in the memo and guidance for retainer days and share that.
Thank you. Those are the main questions that I have on the chat. They are coming to me. This one is a question for Valerie. Is at the start of the pandemic, providers were encouraged to apply for grants, donations, and loans from other resources. Now we are being told that those monies may reduce or eliminate any retainer days revenue. Why is that happening?
I am not familiar with anything about reducing retainer days due to other financial assistance that may have been secured by a provider. I know for those who are, submit cost reports to us, we have asked for information, but we will not be taking back any retainer days that have already been approved.
Okay, Valerie, this one's for you too. Has there been any movement to add isolation days to cover second outbreaks in group homes? This would be a Rhonda question first and then Valerie. Go ahead.
Yeah.
So again, we have not from my knowledge, we have not been allocated any additional funds to extend isolation days beyond what we have in our Appendix K. Currently, that says up to 21 days, and so we do not have any additional funding that I'm aware of to extend that. Valerie, do you have any other information?
No, that is correct, Rhonda. That is absolutely correct.
Rhonda, can you point to the audience where to find the CMS's guardrails?
So great question. CMS in their FAQs that they issued related to COVID-19 on their website would have those specific details. We did outline them in some webinars several weeks ago, maybe a couple months. We'll include the link in our guidance that we share related to that as we issue the new guidance so that people can refer back to them too.
Okay, and this one is Valerie. When we were first told to submit error updates for retainer days, we did that right away. What has happened to them and who has them? Because a few weeks later, you advised us not to submit the error updates.
So they are on hold and they are being held really at two places, either at the regional offices or if they had already come to headquarters, we are holding them there. So they are, as I said, they were being held either at the regional offices or if they had made their way to headquarters, we are holding them there. So we've not taken any action to process them because we didn't want to further complicate the situation.
And this one is an ask. I was hoping that the DDA would be requesting more days since we are where we are and expect to be impacted like this for many more months to come. This one is, and it's been asked by several people, and people are getting confused about the Appendix K. When does it end, and when, based on the extension of the 6 months. So, Rhonda, can you talk a little bit about Appendix K ending on March 12th, 2021, and then what does it mean 6 months out?
Sure, that's a great question. So just to get everybody on the same page, our Appendix K became effective March 13th, 2020, and is currently set to expire within 1 year. So that would be March 12th, 2021. The information we're sharing today, as noted on the dedicated slide, CMS issued new guidance December 22nd. We provided the link for that, advising states that they can request that their Appendix K be extended for an end date to up to 6 months after the public health emergency ends. Given that we do not know the date that the public health emergency will end, there is no specific date that will be noted in the Appendix K. Only that once the public health emergency is declared to have ended, then we could count from that date after up to 6 months. So at this point, we do not have a specific date for when Appendix K would end at this time.
Thank you. And this could be for Valerie or Rhonda. Now that the retainer days were extended to 60, are we able to request and adjust to the end date for services and bill the additional retainer days?
So Valerie, I'll just add a couple thoughts and then turn it over to you. So again, these 60 days will be associated with the Appendix K. So they become effective March 13th until the Appendix K ends. We will be providing additional updates and guidance like we're talking about related to the AIR updates so that providers have an opportunity to go back and review, look at dates for which they could submit a request for retainer payment, taking in consideration that the consecutive billing requirement was removed, and then make adjustments. And that's the update and the guidance we're talking about that we're working on to issue to you. Valerie, anything you want to add?
Yeah, and I would recommend at this point that, given the questions, and this has been very helpful today, because as we've said multiple times, we will be updating all of the guidance that we have posted to date now that we have this additional approval in the Appendix K from CMS. So I would urge providers to pay close attention when that guidance is updated and posted, so that you can, take whatever action best, suits the situation for your agency.
Thank you, Valerie. Rhonda, this is a two-part question. Is the state, the public health emergency state-driven or federal-driven? And what happens if the public health emergency doesn't end on March 12th?
Great question. Yep, great question. So the public health emergency associated with the Appendix K will be the federal public health emergency declaration. So that would come from the president. And because we don't know when that will be at this time, the March 12th, 2021 date will therefore be, in a sense, erased and replaced with the language that the end date for our Appendix K would be 6 months after the public health emergency is declared to have ended, and that will be from the federal government. So at this point, the March 12th date no longer applies. It would be 6 months after the public health emergency ends.
Okay, then this is for Valerie, and I'm going to combine this question. It's like there's 5 questions related to this, so I'm combining them all. When can we expect the 4%? Because I'm waiting to a confirmation to increase my DSP wages. And then the other one is, since we received the advance payment already, how would this impact, and are we going to receive a separate payment for the 4% increase?
So I'm going to really focus on the legacy systems, so those services that are still operating within PCIS2, which are most of the services. So we're still in the process of updating it because, as you know, we have a prospective payment system, and so we are currently updating the process of making those changes in the system. We are still looking at the impact in terms of relative to the advance that was done back in the first quarter of the fiscal year. And, as soon as we have some clarity on that, we will be sharing that. But normally the third quarterly payment, which, providers should have received by January the 6th of this week, really is the earned amount for the first quarter of this fiscal year. So we are still looking at that, but the rates will be updated, hopefully shortly in PCIS2.
Thank you, Valerie. We have 1 minute, and I think the last one is, how do we bill retainer days for personal supports in LTSS?
I believe that they have to be billed separately. And we have information, that information has been provided, and we will go back and share that with providers now that, so many of them have transitioned into LTSS. So if you don't have that information, we will reissue that so you all know how to handle that.
Okay. Thank you so much. I just want everybody to know that we are following the governor's basis on our vaccine. And as we get additional information, we'll make sure we will share that. Bernie has been saying how much we need to make sure that people have current information as quickly as possible. So we are working. If you feel that you need additional information or recommendations, please let Valerie or myself or Bernie know so that we can adjust and make sure that the webinars have that information for you. So Bernie, would you like to post those out?
No, I just want to thank everybody for your questions, and we had a good turnout today. And I'm looking at the number of attendees. Again, I think you need to reach out to us. Let us know if there's any different subject matter that you want to hear on these webinars. And again, I want to thank you for all you do. And again, Happy New Year.
All right, thank you, everyone. Have a good week.